Right, it looks like we are all set. I will now turn it over to Program Director Bethany Adams.
Thank you, Keisha, and thank you to the center team and Eric Scorsone, and to all the hospital and clinic staff that have joined us today. So it's our pleasure to spend this hour with you to share about how we can help you with various services to help you to rethink recovery and how to stabilize your situation and re-engineer, have a new focus for this new world in COVID. Next slide, please. Thank you so much. So just as a reminder, yes, we are the National Rural Health Resource Center. We are a nonprofit organization. We are dedicated to sustaining and improving healthcare in rural communities, which is why that we have come to this with you today and next Monday as well, on the 29th, to help you rethink about how we can help you with the available services and give you a broader sense of all the wonderful resources that at the tip of our fingers that can help you in re-engaging your community and repositioning for this new world. This program is the center. This is our center staff. We are pleased to have the entire team on today. And so once again, I just want to say thank you for our Delta team for putting all these opportunities together and working very hard to make this successful and to help you in your recovery as well. Thank you. Next slide. The Delta Regional Authority and the Federal Office of Rural Health Policy, they have partnered together to support the Delta Region Community Health Systems Development Program. And so we want to continue to support them and recognize them for their vision for this program, and for stop and pause for a moment that say that because this program is so flexible, it provides you the opportunity to identify your current service needs with recovery, re-engineering, and community re-engagement. So they have provided some great flexibility here, as you'll learn today. And then, of course, we want to recognize the Delta Regional Authority team. And the Delta Regional Authority team, and they are very committed to improving health outcomes throughout the Delta region. They feel very strongly that healthcare is the economic engine that really drives the future of these communities, as you know. And we are going to have a deeper dive into that conversation today as well. And then Rachel Riscato, she's our federal project officer with this program, and we want to recognize her for her guidance in rethinking about what sort of services can we offer and how to make it effective for you in post-recovery world, well, post-COVID world. And with that, I want to turn it over to Alyssa. She is going to present the agenda and start us off in this conversation today. So Miss Alyssa, I'll turn it to you. Thank you.
Great, thanks Bethany. In the last week or so, you guys received emails from our team for 3 meetings. The one for today, and Bethany mentioned, we have one next week, Monday on the 29th, and then some small group meetings we'll host in the first part of July. Today's discussion will focus on the why. It's important for each of your organizations to plan for stabilizing and re-engineering operations to recover and succeed in our current health landscape. The why it's important to have a holistic approach across all industries in your community. Eric Scorsone is joining us today to lead the discussion on the importance of each of your organizations are for the economic stability and the development of your community. We also have some time because we want to hear from you. What are the pressures your organizations are facing in continuing operations? What are you beginning to focus as you begin elective and preventive services? Or what would you like to focus on but may need some assistance? Or even the questions on where do we begin? At the end of our time today, we'll begin to share how this Delta Community Health Systems Development Grant, you'll hear me refer to it as Delta for short, is able to help you with this work. Our team, the Federal Office of Rural Health Policy and Delta Regional Authority, has re-engineered our technical assistance to assist you guys with this work. Next Monday's June 29th webinar is where we'll dive deeper into the how and the what this grant will be able to help your organization and community with. We'll provide information on additional services that are available for you and the importance of utilizing the relationships that you have and are developing with your community joint partners through the community care coordination activities you're working on or are just beginning. The small group Zoom meetings in the first part of July will be opportunities to share your initial plans, network with another facility, and work with our team to answer questions, work through concerns on that how, or plan to move forward. As today, and as we move forward in our next Monday in our Zoom meetings, we love discussions and questions as we go. So please feel free to speak up, use the chat box. Keisha shared with you how to raise your hand electronically through the participant list as well. And Keisha is going to help us monitor the chat box and raise hands to make sure that we hear you in real time when we're walking through this. We've had many opportunities to talk with your team, including the community champions. And we've heard some of what your organizations need and want are doing to impact the health and economic wealth of your community. Our purpose is to make sure your organizations are aware of how the Delta program can support hospital, clinic, and community leaders with services to help recover, stabilize, and move forward. We want you to see and understand how we can help you expand the way each of your hospital and or clinics are working within your communities. We'll build off the work you've begun connecting community care coordination with hospital, clinic, and community priorities. So why? Why is it important for each of your organizations to stabilize, re-engineer, and open operations to fully recover from this latest health emergency and succeed? The numbers on this slide are averages across the 21 communities. It's 22 organizations in all. We'll share with you, each of you, your specific economic contribution your facility or organization has in your county after this webinar. These numbers on this slide are the average across the 22 organizations currently engaged in this Delta grant. So kind of going from left to right on this slide, on average, annually, the economic output or the total local revenue in the county generated by the hospital and its employee spending is $43,635,400. This is what each of you, your hospital and employees of your hospital are buying local in your county. It can be from housing, groceries, fun activities, and anything else that you're spending your money on. On average, I'm looking at the middle box now, the average earnings is defined as the total local income in the county generated by the hospital and its employees spending. Not only are the employees of your hospital and clinics earning income by being employed, but because of the spending generated from the hospital and each of its employees, it's creating $12,326,900 of income for employees in other industries in your county. Look at this. Everyone loves the jobs. How many have been created? How many are available? The average number of jobs supported by hospital and clinics employee spending is 2,305. These aren't just the jobs that are employed of your employees at your hospital and clinic, but these are jobs supported by the spending that the hospital and clinic and the employees do within the county. Like I mentioned, we'll provide each of you your specific economic contribution to your county after this webinar. These numbers here were an average of the 22 organizations currently involved in the grant. Many organizations understand the importance of community development and the tie to economic health and wealth of their county and the community. But oftentimes the healthcare sector and its importance in that economic health is often left out of the discussion. Community development, as you can see on the slide, the definition is the planned evolution of all aspects of community well-being, economic, social, environmental, and cultural, a process whereby community members come together to take collective action and generate solutions to common problems. As you can see, healthcare, access to it, the health of the community is not included. But those of you that have been studying the importance of community care coordination within our program will notice many similarities. Community members come together to take collective action to generate solutions, as mentioned above in the community development definition. We focus on, in community care coordination, partnership among healthcare professions, clinics, hospitals, community services, and other joint partners and resources. The focus of working together to provide better coordinated care and access to resources. We need to connect the work of the community development in each of your communities and the work each of you are doing in the community outreach and connecting through the community care coordination work. There are huge benefits and wins of connecting the two. We created a handout. Keisha mentioned that that's in the that chat box called The Benefits of Community Development and Community Care Coordination. Please take a look. You'll see processes, key activities, and goals outlined. An example, some things that you see, the benefits of both, like effective communication among community leaders, providers and social service agencies, promotion of community services, and utilizations of local resources. And this includes having other organizations include the services your hospital and or your clinics are offering. There's a lot of opportunity for this connection, as many of you have seen in the community care coordination work, to become aware of services available, to deduplicate services and improve operational efficiencies among your organizations. The goals of and resources offered through this Delta grant are uniquely positioned to assist you and will be customized to meet your organizations, to meet you where you're at. Many of you are utilizing the technical assistance offered from our key partners, BKD, Stroudwater, Huron, to name a few. But an area that most of you can increase involvement in is connecting that work with your community outreach and coordination. By working with your partners and people of your community will not only support the goals of this work that you're doing in these action plans, but in turn will help your community members and organizations too. An example of a specific resource that this grant is providing you is funding monetary support for the community champion. This past program year and over the last couple of years for some of the champions, they've been part of trainings and been provided tools. Those trainings and tools have helped identify what key partners are needed for what area you're working on by walking them through steps in the community partners worksheet and the circles of engagement activities. We're not adding on or asking you to do community development. We're building off the foundation of community care coordination work each of you have begun and begin to connect the two. It will be important for you to share the services each of your facilities offer, to hear from community providers, and to hear from other organizations what they need. Determine together what each of you need to do to stabilize Reengineer operations to recover and succeed. You'll be surprised about how the goals and priorities will be similar and how you can help each other. The Delta program can and will help with this. We'll help facilitate these discussions, planning, and implementation of those. On June 29th, we'll dive deeper and provide a working scenario tour of what I'm talking about here, what the holistic approach will be and what it does look like. I don't want you to take my word on this. Those of you that know me know I have an extreme passion for this and could go on, but I want to take time to introduce Dr. Eric Scorsone. He's Associate Professor at Michigan State University, Senior Financial Advisor to the City of Flint in Michigan. He previously worked as a senior economist at the Michigan Senate Fiscal Agency and developed award-winning extension programs in the Department of Agriculture and Economics at the University of Kentucky in the areas of rural health economics and economic development. He has many other achievements, and I could go on. We've asked him here to join us today to expand upon the community development and how the hospital fits in, what role healthcare plays, and to discuss the opportunities of connecting the healthcare sector and other industries. Eric, I'll hand it over to you.
Thanks, Alyssa. Good to see you all. Let me first talk a little bit about what I'm doing right now, because I think it'll give you some context. So yes, I'm a professor at Michigan State, but vast majority of my time right now is spent at the City of Flint as acting CFO and kind of living this strange world we're in with the rest of you. We also have a city-owned hospital, so dealing with those issues. And the city-owned hospital has already laid off a number of people due to the COVID restrictions. The city government has been under tremendous financial stress, dealing with all kinds of issues, securing supplies, dealing with first responders, etc. So the world has really been turned upside down. The city of Flint, of course, went through the infamous water crisis 4 or 5 years ago. That's still ongoing, actually, even now. And so this crisis came on top of an existing crisis. And we've reconnected hundreds of people back to water, because in a pandemic, obviously, you want people to have access to water. And what I can tell you is that interconnection is critical. This, and I want to kind of start with this story, and then we'll talk some more about kind of the framework that we're thinking of for you. But, it's very clear that a city government under these conditions can't fix all the problems of the community. We have to reach out to partner with nonprofits, with universities, with businesses, so that we can move the community forward. And we've done that a number of ways, whether it's committees and task forces. We don't agree on everything always, but the critical issues are we're working together, because the community is already very stressed. It's a financially distressed community. It is a community that is stressed from a water crisis, the poisoning of the city's water system. And so this crisis came on top of that. And Flint has been very hard hit by COVID. We've had several hundred deaths, several thousand cases in a community of 100,000. So it's been very difficult. But you realize that, I guess I'll give it to you this way. I think, we're all trapped in our daily fires in our own organizations, doing the things we have to do to make our organizations work. For me, it might be filling out financial reports or making sure accountants are doing their jobs or whatever it may be. But the reality is, I also realize to be successful, for the city government to make the community better, to provide those critical services, whether they're public health, public safety, zoning, whatever it may be, we have to work with other organizations. We have to take the time to talk to the school district, which is a separate government. We have to take the time to talk to our businesses, our small businesses. What do they need? How can we support them? So it's taking that time out of our days when we're fighting fires and doing the things we need to do, to realize that we're in this ecosystem in a sense, and working together to be successful. And certainly the city hospital, we have another hospital in town, a nonprofit, larger entity. And again, yes, there's competition, but also looking at how we're going to work together, because we're facing a public health crisis. So I just want to really emphasize the importance of getting outside of our organizational boundaries. I think the economic impact that Alyssa talked about is critical, and hopefully you may have seen those kind of things in the past, right? And that basically tells the story of if we were to take the hospital out of the community, what would be the full impact? Even if we were to cut back, it would be some portion of that impact. And that's happening today. We know it is. And many hospitals are having to lay people off because of restrictions on other services they can't provide at this time. But there's a real strong interconnection beyond just that economic impact that I really want you to think about. A healthy population is a population that can work and is productive, and is a population where you can attract employers. You can allow current employers to grow bigger, right? And so that's a critical connection the other direction. Yes, the hospital and hospital healthcare providers in general provide a lot of jobs and are good at, and they've probably done more of that in the last 20 years than most industries, especially in rural areas. But I think there's another aspect to this, is which, if we can maintain and help maintain a healthy population, whether that's through healthcare, but that happens through other things as well, right? Whether it's wellness or other programs. Parks and recreation is something many governments have cut back on, but I would argue if we want a healthy, especially youth population, you need those kind of services, right? And so that's the critical element I want you to also think about. We can actually start to even quantify some of this potentially for you in the future, is thinking about how you're doing other things for that local employer population so that they can thrive and do well. And certainly in Flint, we've done that. We've looked at how can we as city government provide for the public health. We do it through the hospital, but we also do it through parks and recreation programs. We do it through ensuring people have access to water that is clean and healthy. We do it through making sure Flint has been really in the frontier of leading in police community relations, for example, and really making sure the police are there to work with citizens, not against them. And so I think this interconnection is really critical, that the economy impacts the healthcare sector, of course. If you have a poor economy, the healthcare sector is going to suffer. But vice versa, a strong healthcare sector that can provide for a healthy population can really boost that economic structure. And so the two really are interrelated. Next slide, please. So if you think about poor local economics, whether that means you have not many employers or those employers are under a lot of pressure. And we know a lot of employers today are under a lot of pressure. We've had the ability for some of them to be sustained for now through the PPP program and the CARES Act from the federal government. But we also know a lot of businesses are suffering. And when some of these federal programs go away, we're going to probably see the reality of, are we going to face more local bankruptcies? Are small businesses going to survive out of this time? We just don't know. But that, it means it's critical for you to engage with your chambers of commerce and other businesses and see how you can help make sure that local economy is as strong as possible. Because I'm sure you can realize these are very obvious things. If you have a poor local economy, you're going to have poor payer options. You know, Flint is a great example. We had General Motors, right, who had excellent healthcare. And so for a long time, the hospitals and healthcare providers in Flint lived off that sector essentially. And then that sector, I'll give you an example. In 1980, Flint had 80,000 GM jobs. Today, Flint has 7,000 GM jobs. So essentially 90% of the jobs are gone. That has had a huge impact on the healthcare sector of that community. It's reduced the number of providers. It's closed a lot of facilities other than those that are more federal or state funded. And so the economy can really impact that healthcare sector and provide for a lot of pressure on how you can provide services. The other side, though, again, I want to strongly emphasize, poor local health at the same time, right? Sometimes we have to cut things, but that may be short term. If we think long term and say, is it really good to cut parks and recreation? Is it really good to cut money for affordable housing? All those things can affect people's health. So it's not just the hospital doing what it can to make sure people are healthy, but I think it's also important for healthcare providers to recognize housing, jobs, and other things affect people's health directly. And that impacts the workforce, particularly productivity of the workforce. If people are out a lot, I mean, Flint is suffering from this. People are not as productive as they could be. A lot of people are in poor health, which is one of the explanations for why COVID has been so running rampant in the community, because of a lot of pre-existing condition issues. And so again, that leads to higher health costs for the employers. We as city government face higher health costs because of where we are. It's essentially a health tax. So you can help your local employers not only through the jobs you provide, the spending you provide, but also through reducing this health tax, because the healthier their workforce is, the lower their costs are going to be, and the more they can do to be productive employers in the community. So I just want to emphasize, I'm happy to answer any questions, is how we can help you. You know, we've talked here pretty generically, but I think in a community we can help sort of sort out some of this very empirically, very driven at that community level to help you understand how you could tell your story. I've tried to give you examples from Flint, where I'm working now, to kind of show you how it works and how I think that story can be told at a community level of why all the different sectors, as Alyssa pointed out, need to work together. And working together takes time. It takes, you know, time is our most, you know, scarce resource. We all know we're in a day, 8 or 9 or 10 or 11 hours, how many hours you work in a day. And it seems like those days go by so quickly, right? And it's at the end of the day, you're often asking, okay, what did I really get done today? And sometimes going to that community meeting or calling that, you know, school district or that business chamber of commerce may seem like time you just don't have. But I would suggest it's something we do want to build into our schedules, as difficult as it can be, because I think reaching out, working together, realizing this nexus between economy and health is really critical.
Thank you, Eric. If no one has any questions for Dr. Scorsone, Terry Hill, if you're on, please unmute.
Just in case that he can't hear you or if he's having technical difficulties, I can go ahead and step up for Terry. I'm sorry, I'm not nearly as good as Terry, but Terry, if you are, if you hear us, if you can chime in, love for you to help us.
Bethany, can you hear me?
I can.
Okay,
wonderful.
Thank
Everybody
you so
else
much.
Thanks you too.
Yeah, great. So now we're a part of our agenda where we're going to try to hear from all of you, because our program basically wants to re-engineer our services so that we can provide the maximum benefit for all of you in that regard. So I have some questions I want to throw out. First of all, we'd like to get some personal perspectives in terms of what type of demands and pressures are you facing in continuing your operations and meeting your community needs. So you can either type something into the chat box or unmute your line and let's hear from you. We understand that rural hospitals across the country are struggling to stabilize. You know, basically what we're suggesting here is that our Delta program has resources and has help in terms of the re-engineering process. We're never going to be the same after this COVID-19 crisis as we were before. And we need to be thinking about how we not only stabilize, but as we see in the diagram, how do we reposition ourselves for the future? Let's see what you have to say.
Just a reminder also, if you want to unmute, raise your hand first and we will call on you.
And please, somebody speak out. What are the pressures? What are the demands now? What are you experiencing moving forward?
Terry, we had one chat come in.
Good.
They said limited outreach activities due to COVID. And that was the community champion from South Mississippi Regional Medical Center.
Okay, terrific. So it's limited outreach. What type of outreach? Could you let us know a little bit more about that? Is it getting out to the community itself? Getting patients back in the hospital, the census is down. And I think we've been seeing that across the country, significant drop in census, particularly during the period when we had to forego a lot of our you know, kind of outpatient procedures to prepare for the COVID-19 crisis, et cetera. Anybody else want to speculate? So census is one of that. What about financial pressures?
Yeah, this is Alyssa, and I think too, picking up off of Amy's limited outreach activities due to COVID, much of the work our champions in this program has done has been in person. We've done in-person gatherings. We've gone door to door. They've gone through calls, and I think too, with just the shutdown or stay-at-home orders in our different states and communities, and then now we're having to rethink, how do we interact? How do we do this meeting? How do we talk to each other and create these plans? So I think too, it's that I think, you know, and Amy, correct me if I'm wrong, but some of that limited outreach is due to the shutdown, you know, stay-at-home orders, things like that, layoffs. but also a lot of our work has been done in person, and we haven't been able to do that again yet in the way that we've been able to before.
I apologize. Amy, I saw you raise your hand. You can go ahead and unmute and share a little bit more.
Yeah, please do.
Thank you. I was struggling typing all of it in. I'm sitting here with several people right now, and it's just kind of the way that things have closed or have had severely limited in-person interaction due to COVID have hurt us a lot in our, not just outreach, kind of like with the community champion work, like going to chamber events or civic clubs, doing presentations and that kind of thing, but also doing community outreach activities that the hospital has done, like sports physicals, going and doing things with local companies like health fairs, job fairs, screening appointments, different things that kind of help meet our patients and potential patients and members of the community where they are. Everything has really kind of slowed down, and especially in our area, we kind of have a technological lag. so there are a lot of groups that aren't quite just immediately switching over to digital. They've just stopped. So it's been, you know, it's been a learn as we go, but that's been a big challenge in our outreach.
Thank you. We had several other comments here.
Terry, do you mind if I just jump in on?
Jump in, Bethany, absolutely.
Because Josh and Stephen from Iron County have made two great comments. Loss of the ability to hold those regular, you know, town hall meetings to really capitalize on that alternative communications. Absolutely, that is one of those key talking points. I'm so thrilled that you brought that up, Joshua. I really believe that this is one area that we can assist you in. For example, just re-engaging them in the importance of everything that just Eric Scorsone just talked about. So one of the things we've done with Eric is to create economic impact statements of your hospital on your community in a one-pager. So it will be a tool that you can have, you know, in hand to help initiate that immediate conversation to get their attention. And those hall meetings, as you know, many of them are those local businesses. So we're going to be getting those out. And then to Stephen, your comment regarding staff education, staff development. Well, again, two thoughts to that. Through the community care coordination team, helping you to rethink that promotion, helping you to re-engage your community and help them have that community-wide messaging that it's safe to come back to the hospital and it's okay to continue on and we can serve you. So there'll be some funds to help you in that process. Alyssa, do you want to engage on that?
Yeah,
topic?
I wanted to just follow up on that too, from Joshua's statement too on that alternative communication methods. And part of that, you're absolutely right. We have to figure this out because as we know, we're not returning to normal very fast. And if a second wave and when it does hit, you know, we're going to be less likely to be out in the community as well too. And so the Delta program, as you see, has upgraded to Zoom. You've had some meetings with us over the past a couple of weeks. The champions have been fully fledged in Zoom operations, practicing it as well too. So we're in the midst and have transitioned a lot of what we would have done in person with each of you in those town hall meetings, community connect events, priority planning meetings to transitioning to those over the electronic. So we can help with those alternative communication methods for planning, outreach, and then also in that marketing aspect as well too. That's what our teams are here for as well. I just wanted to say that, Bethany, that we recognize that these alternative communication methods, planning, outreach are happening, and we have the ability to help support that as well.
Yeah, and I know Joshua had said that basically using the website to basically come up with messages, and it just needs to be something that's pretty consistent, that is, as you said, I mean, we've got to get patients back. There's such, you know, I mean, the problem is not just our financial bottom line here and getting more volume. The problem is our folks are getting sicker. They're not using the services that we have available. So I'd want to throw that in as well. That in essence, we're anticipating a health crisis over and above COVID-19 here, as our chronically ill patients, if they're afraid to come in, are simply going to get worse. Let me throw out another question: is what priorities, or what have you guys been doing what have you started to explore to stabilize the facility and the community? So what strategies are you thinking of to get your hospital back into financial health, to basically build up volume and to better serve the community itself? Some ideas of things that you're thinking of.
Missy's from St. Genevieve. Hey there, Missy. Thank you so much for chiming in as well. She has shared that community entities are still unstable with inconsistent restrictions. That's definitely going to be a huge challenge. And I encourage Eric Scorsone to chime in on this, because I know that he has definitely been working with different organizations to balance that act. So Eric, if you've got recommendations, feel free to join us on that one.
Sure, yeah, sorry, I got kicked off of the Zoom call. We're all learning with these Zoom things can happen. I guess that's one of the challenges of operating in this new environment. Yeah, I mean, I think we're all I think the biggest challenge every organization faces right now is uncertainty about the future. Each state is dealing with this situation differently. Some are opening up very quickly and reducing restrictions. Of course, we all know that doesn't mean people are just going to rush out and go do whatever they normally did. So I think I think it's so true. And Flint is very similar to rural areas. People want to be met where they are. It's important to have those community meetings, but they're not realistic right now. And yes, social media can help with some of that, but I know there's a lot of people that maybe don't have access to those things in some cases. So I would strongly encourage you to do social media as much as you can to stay in touch with people. There are some businesses that are using this opportunity to build their clientele, because they're able to reach out to people they weren't able to touch before. So there can be some benefits, but I'm not going to kid that this is not a difficult situation. And I think our hospital has been trying to keep goodwill in the community, trying to reinforce that you can get here quickly, because a lot of people in Flint, maybe like rural areas in some cases, don't have access to private vehicles. They rely on public transit. Public transit was shut down for quite a while. Some people don't want to use public transit. The elderly may not want to go anywhere. They may feel uncomfortable. So again, I think it's really reaching out to the community in new creative ways, and then trying to retain that community goodwill, which is going to be critical in the long term, to both recover and, as we're saying, reposition. Because I think recovery is fine, but my guess is the world's going to look very different in 6 months than it does even now. So I think you need to be ready to kind of be very agile, agile and moving quickly, because I don't think the world's going to be, I think we're going to see a lot of big changes down the road from this whole situation we're in now.
And while we were talking, we had several other comments here. One was use a local paper. The paper really struggles to put content in. I don't think we ever take as much advantage of that as we could. Other comments, I think, seconding to what you're saying, Eric, is use the social media. People are on it even more than they were before during this pandemic as well. One last question, and so we've talked a bit about patients and about the the new demands and pressures, et cetera. But what about our staffs? And what way are our activities and priorities kind of engaging and benefiting our staff and our community partners? It's been difficult for healthcare providers. We're certainly being recognized, certainly by the media, et cetera. But how do we support our staff, make sure that their needs, their well-being is taken care of as well? Any ideas on that, folks? Any suggestions? Anything that we as the Delta program could help you with? Any comments on this?
I think another way to look at the question too is what are you doing to help your employees in this time? Flexible, work schedules if possible, daycare, things like that. Like what are some of the activities that you have been doing with maybe some of your local partners to help support not only your staff, but their staff?
Joshua had a comment, but I couldn't read it all.
Joshua said one of the biggest challenges for them has been really digging into what equipment and processes we need in order to be well positioned to weather a surge of COVID-19 cases. We have encouraged input from all staff with the idea that there are no bad suggestions. It has really helped us strategically position for the future.
Okay, excellent point. Anything else, folks? Well, if you do have comments, again, we're just kind of throwing them out at you right now, but do let us know. If you've got other thoughts that come to mind, any ways that we could help you in terms of lessening these demands and pressures, in terms of kind of exploring new priorities, re-engineering, et cetera. And finally, if there's a way that we can help help with the staff or with community partners, et cetera, again, please let us know. So thanks for the discussion, those of you that participated in it, and I'm going to turn it back to our folks.
Thank you, Terry. I guess, as you've heard today, Dr. Scorsone, Ms. Miller, Mr. Hill, they've just made a compelling argument for just how critical it is for leaders to take this more of a holistic approach to recovery, thinking about both the hospital and the community acting synergistically. So we want to share just some examples just to get you thinking so that you can chew on it a little bit and go back to your teams and think about knowing that you have such great flexibility through this program, maybe how can we help you? And again, we want to help you from a holistic approach. So we want to share some examples of how to think about re-engineering your services to support operational recovery. And most importantly, re-engineer community engagement. So your hospital, I'm just going to share some examples that might have come across in terms of needs. I'm putting it out there and it'll just hopefully get you thinking. So your hospital may need some assistance with how to manage all the funding you've received through these federal programs. We've heard hospitals just taking the funding and then not really thinking about all the other now aspects that go along with it. So BKD can help you with, say, managing those challenges, considering the payback, audit, tracking, reporting, compliance, cost report implications. And yes, of course, there's technical assistance to help you with, say, revenue cycle challenges, particularly decision-making with regarding cash acceleration, and then how to manage that too moving forward with low volume, and there's going to be a time lapse for re-engaging your team. But it's not just financial. Financial is only one part. And as you've heard from Eric Scorsone, that it needs to take multiple approach to be really successful. So we also are offering, say, special staff development opportunities. For example, one CEO asked, goodness, they like to offer some staff training on personal finance planning because so many of the employees were struggling with cash management during the COVID, they had possible layoffs. We're offering leadership training for crisis management or during crisis time. And again, maybe this is something that could help your managers to can work more one-on-one with your frontline staff. That's so critical. And again, I saw several comments there from the chat box regarding telehealth. The healthcare industry has taken a huge steps towards adoption of telehealth during COVID. Time's not going back. Patients have learned that they don't necessarily need to go to the hospitals now. And moreover, I was just sitting on a webinar that's designed for larger urban facilities. They are actively developing, virtual care business models, which include specialty cares. So they're ready to compete with you in your market area now more than ever. So during this Delta program, during these sessions we're going to have with you, we know you're already working with Kate and Huron, but let's take that a step further. Let's really think about your virtual care plan and how to best align those services with your community and recapture that market share and rethink the outreach approach. It's just a new day. It's just we're not going back. So we really need to have a new plan moving forward. And that's what we want to help you with. Next slide. And as you've seen that, so we've heard from so many of you in numerous ways now about, gosh, the need to communicate with your community. So we really want to emphasize that through community care coordination, we can help you rethink those communications to better promote those services, help you build that awareness that it's safe to return to the hospital. We can work with Eric Scorsone if you need some additional education and coaching directly with some key partners in your community to help them understand the importance of this link between community care coordination and community development and how to really maximize that local economic benefit, really to better serve the entire community. And lessons learned here through the pandemic, it's even more important to improve that community perception of the local business, hospital, and clinics, build that community awareness of available services using various means. And even someone talked about the good old newspaper. We're back to some of those good old days that still we need all means possible to reach various people where we can't get out. Enhancing marketing opportunities. We have some funding to support promotion of services, and you can work with the community care coordination team on that. And then most importantly, consider ways through community care coordination and the consultation team to work with your local businesses to improve, reimbursement and local revenue overall. You will be receiving, a one-page handout for the economic impact of your hospital, your clinic on your community. Again, hopefully it gives you some talking points. Again, we want to help you have a holistic approach, and so it's a win-win for the hospital, for your community, and to make it sustainable moving forward. Next slide. And then I know we're here at the top of the hour, and I want to honor your time. But we do want to reiterate what Alyssa said earlier. So the next webinar is on the 29th. We'll dig down on the 29th to understand the how and the what. We'll discuss what can your community do to help you, and what can you do to help your community. We'll do that in a little bit deeper dive and follow up what Dr. Scorsone was sharing. Alyssa and the team will also help you through some one-on-one Zoom planning meetings to outline what services and develop a plan so that we can initiate the services as soon as possible. We want to start this ASAP. When you're ready to start, we will roll it out. And so if you haven't signed up for a Zoom meeting, you can email any of us. Feel free to email me as well. And if these times don't fit, please suggest a date and time that works. With that, I think we can take any last minute questions that you may have or last minute comments. I also want to know if, just hoping that you've planted a seed in your mind that, gosh, this is not just services, very small and structured options. This is organic. So what does that look like for you? So make a wish list and think broader, think holistically for the community and yourselves. With that, is there any questions? Terry, any last thoughts or comments? And we really appreciate you helping to facilitate.
Sure, nothing particular, Bethany. I'm really so pleased that so many folks attended, and I'm really excited about the program moving forward. And again, anything that we can do let us know how we can help.
Thank you. Alyssa?
No, nothing further. I look forward to next Monday's discussion where we get to really deeper dive into that holistic approach and some examples to get wheels turning even more.
And got something about they like the one-pager economic impact. That's great. Yep, we're going to get those out. And again, many thanks to Dr. Scorsone for helping us do that. With that, then again, thank you so much for your time today. And we will look forward to our follow-up. Have a great day, everyone.